Well, good morning. My name is Anthony Quinn. I'm the Chief Community Officer at CARP, and we are continuing our discussions with leaders of Ontario's provincial parties. And today we are glad to be joined by Mr. Mike Schreiner, the leader of the Ontario Green Party. Good morning, sir.
Good morning, Anthony. It's a real pleasure to join you.
We're glad to have you, and we're here today to discuss specific issues that are of importance to Ontario's members of CARP, and we're calling them the CARP 5. We've assembled 5 top issues that are important to our members, and we believe may be not the focus of many of the campaigns across the province. So we'd like to hear from the Green Party about the CARP 5. But before we get into that, perhaps just a word from you on what Ontario voters can expect from the leadership of the Ontario Green Party and from Mike Schreiner as leader himself.
Well, the Ontario Greens are offering new solutions to old problems, especially, I think, some of the cracks in the foundations of our systems of care in Ontario that were especially revealed during the pandemic. And our belief is that we can't paper over those cracks. We actually have to fix the foundation by making the investments we need, especially in expanding healthcare capacity, and especially by investing in the people who deliver care. We're pushing for a 20% increase in home care because we know many Ontarians, especially those who are aging, want to age at home and have the ability to do that. And we need to make sure that we have the home and community care capacity, and especially investing in the people who deliver that care, because we know the quality of care is directly affected by the people who provide the care. So ensuring they have fair wages, guaranteed full employment, have compensation for travel time between visits, and ensuring we have enough staff in place to provide the levels of care people need and to provide respite for caregivers and care providers. We also need to ensure that, our hospital capacity, our family health team capacity, our nurse practitioner-led clinic capacity is there as well. And we know that nurses are the backbone of our healthcare system. And so removing the legislation that the Ford government has in place that caps total compensation so that nurses and other frontline healthcare workers can get the compensation they need and deserve, and to ensure that we can recruit and retain more of those frontline healthcare workers. We have a firm commitment to hiring 33,000 nurses to work in all sectors of our healthcare system. And finally, when it comes to health, really ensuring that we invest in long-term care homes for those people. We obviously want most folks to be able to age at home, but for those who have more complex needs and need a home to go to make sure that it's one in which we prioritize care over profits and put people first, and ensuring that throughout the system, people have access to mental health resources that they need through OHIP. We also know that we need to invest in making sure everyone has an affordable place to call home in a great community to live. And so increasing housing supply and increasing the options that people have. I especially look at opportunities for people to have duplexes and triplexes and quadplexes, to build granny suites and secondary suites and basement apartments, laneway housing, to bring in co-housing and looking at other models, I think, which would be especially appealing to elders so that people can live independently, but not feel as lonely and isolated, and be part of a community through having the options of things like co-housing. And as we build those communities, ensuring that they're safe for people to get around, so people can walk and cycle and take wheeled mobility assisted devices to get the things they need within 15 minutes of their home, and ensure that they can access them through safe streets. And finally, I believe it's absolutely critical for our children and grandchildren, our nieces and nephews, to really do Ontario's part to address the climate emergency that we're all facing, and do it in a way that addresses the real cost of living concerns that so many people have, and ensure that we crush climate pollution in a way that sets Ontario's economy up to be a global leader in the fastest growing markets of the new climate economy. And so we know we can help electrify transportation to reduce fuel costs for people. We know that we can help people renovate their homes, not only to make them more accessible and easier to age in, but also to lower their utility bills by helping them save money by saving energy. So we know we have solutions that can improve people's lives and ensure that our children and grandchildren have a livable future.
Thanks for that very broad overview. And you touched on a number of the topics that are part of that CARP 5. When you talk about solutions, and maybe that's what CARP is hoping to dig out from the candidates, we've all identified the problems, I think, in our healthcare system. Canada spends at the top of the OECD countries, but has results that are far below what we're spending. We're not certain that it's the way or the amount we're investing, but perhaps the way or the use of that money. When it comes to home care, you mentioned hiring 20% more, investing 20% more, but right now we have only 50% of PSW appointments being met, the need being met. I sit on a panel with the ministry right now, and they're estimating there is 30,000 net new PSWs needed to meet just the home care need in the next 5 years. So how what is the solution other than saying we have to hire more or invest more? Where do we get all these great new PSWs from?
Yeah, Anthony, that's a fantastic question. And it's exactly why, first of all, we're calling for a permanent minimum wage increase, at least to $25 for personal support workers, and then looking to increase that over time so they keep up with inflation. It's hard to recruit staff if they're not being paid fair wages. It's hard to recruit staff if they're in very challenging working conditions, and in some cases not guaranteed full-time work, or in particularly rural and northern communities, not always compensated for their travel times. And so, at the end of the day, are earning less than minimum wage. And so having fair wages, full benefits, and guaranteed full-time work makes being a personal support worker an attractive occupation that people want to go into. And then making sure that the training programs, the post-secondary training programs that are available to them, accessible to them, and affordable for them, which is why we've called for and have committed to a major increase in both college and university budgets and in reforming the loan programs for accessing post-secondary, to reverse the cuts the Ford government have put in, and to transfer loans to grants so that we know that people can afford to access the training programs to be PSWs, nurses, and other healthcare providers. And so I see the best way to be able to hire the staff we need and address the critical staffing shortage we have in healthcare is to actually, make it an attractive occupation, a career that people can make a career out of it. Because I know the people who go into, careers like being a personal support worker, they believe in care and they believe in caring for people. And so we just need to make sure that we care for them as well. And then finally, I'll say that, we have a number of internationally trained healthcare providers who, are not working in the caring professions that they were trained for and they're so committed to. And so making sure we provide the fast tracking of accreditation for those who are internationally trained to be able to make a career, either as PSWs or nurses, to be able to care for the people they want to care for.
No, they do a tremendous work for us, and the goal of CARP in our advocacy is not to discount any of the work that our PSWs, nurses are doing in long-term care homes or in home care, but to really focus on the system not meeting the needs of the patients, not the individuals. When you mentioned the low wage policy of Bill 124, The concern about, well, not my concern. The discussion is removing that so nurses can have a higher wage. But Bill 124 is for all of public sector workers in Ontario. Does your interest in removing Bill 124 for nurses apply right across the board for all public sector workers in Ontario?
It does, Anthony. Right now, we need to make sure that public sector workers can negotiate fair wages. I mean, we're in a high inflationary period. I know a lot of the focus has been on frontline healthcare workers, and I think rightly so. I mean, so much of us have been, we've been through so much over the last 2 years. It's been hard. And I think it's especially been hard on seniors, obviously, because of, increased isolation, not being with family, obviously just the humanitarian crisis that we had in our long-term care homes. And so we need to make sure that we have a wage system in place in Ontario that attracts people into the public service. Many of those public service jobs are caring related professions. And we know that the quality of patient-centered care is directly affected by the people who provide that care. And so that's why I think investing in those people is an investment worth making, because it's going to increase the quality of people and patient-centered care in Ontario.
Thank you. The patient-centered care is an important word going around, particularly related to long-term care. And the conversation on the, at the highest political levels tends to talk about building beds and infrastructure. We all know that there's a long waiting list for long-term care beds in the province right now, projected only to get much worse, in crisis mode now. But at the current state, CARP is advocating for a transformation of long-term care. So while you're building infrastructure, transforming the models of care to emotion-based, away from task-based care models, such as the butterfly model or Eden. Would your government support a total transformation of the models of care from task-based to emotion-centered care?
So Anthony, thank you for that question. Our platform really is committed to and talks about a complete rethink and transformation of elder care in the province. And so I really would encourage your members to review our platform. I was really happy that you specifically referenced the butterfly model, which is a model that the Greens have been promoting, and also looking at other emotional centered care models as well. In my writing at St. Joe's, they've done a lot of fantastic work around like outdoor design to make accessing nature and people being a big part of those emotion-centered care models, which I think are vitally important. I also think, and this is really important for me, I really get offended when I hear people say things like long-term care institutions or the sector. These are homes, and we need to design the places where elders live as homes. And so I'm a big proponent of smaller sizes. Obviously, individual people's rooms, because that's their home, and ensuring that we think of long-term care as a home for people, ensuring that we have enough staff in place to absolutely guarantee a minimum of 4 hours of care every day for each resident in each home, not as an average, and providing the funding to do that, to make sure we have the proper ratios of nurses serving in people's homes, and also looking at alternative models of care that you've seen, particularly in some European countries, where you can look at things that are more people-centered, smaller scale, so it doesn't feel like you're in an institution, making sure that dining options are well funded and people centered on people's own times and individual schedules, ensuring budgets are sufficient enough that people have access to, healthy local food options and choices, making sure the standards of the models of care and the design of homes and the food choices there are culturally appropriate and that reflect people's needs, ensuring that couples can remain connected and united and not separated. So I think there's a whole host of ways in which we absolutely have to rethink long-term care homes. And I think a big part of that is rethinking community and home care as well, to ensure that we have the policies in place that people can age at home as long as possible, that we invest in things like seniors-focused community centers. We have a seniors community center in Guelph in my riding, and I think it's a fantastic model to provide, social space, to break down isolation and loneliness that people can experience, particularly seniors, to provide spaces and opportunities for physical exercise and engagement, intellectual and cognitive engagement, building community, staying active. All of those are really important components of, aging well and thriving. And I'll just close by saying, creating intergenerational opportunities as well, for the wisdom that so many of our elders and seniors have, to be able to continue to have methods and models where that wisdom can continue to actively benefit our communities, which I know also benefits the individuals providing it.
Yeah, and that brings up the last 2 points of our CARP 5 that you've already alluded to, and that's prevention and staying engaged. On the prevention side, on the medical front, we're looking for a commitment from the candidates to fully fund adult vaccines for pneumonia, shingles, influenza, particularly the higher dose shot for older adults in Ontario. Right now, my own personal anecdote is when my father was advised to get the pneumonia shot by his family physician. It was a prescription, and then that was taken to the pharmacy, and then the pharmacist would order it, and then we waited for that to arrive, and then we had to make another OHIP-funded doctor's appointment back to the physician to give him the shot. So that's obviously not very efficient, and it cost him a couple $100 out of pocket. So would your Green Party of Ontario support fully funded adult vaccinations?
Yeah, absolutely. It's something I've been advocating for at Queen's Park. It's the Green Party fully supports adult vaccinations, and I'll just expand that a bit further too. We support the province partnering with the federal government to bring in dental care through OHIP, and at the very least, in the interim, in doing that, expanding the age cutoff for low-income seniors dental access. We absolutely have opposed the freezing of optometry, OHIP-funded optometry 20 years now, to actually bring that up to the cost of delivering service, so people can access.
I will say that was the last. That was
eye care through.
I was going to say
go ahead. Yes, sorry.
That was the last place we met in person, was on the steps of Queen's Park when you were out supporting, I think mostly supporting the patients,
absolutely
the seniors and the children who were caught between the providers and the funders. So how has that played out, and what would the Green Party do to ensure that the seniors don't fall and have their services revoked again?
Yeah, thank you for that question, Anthony. So, right now, obviously, those negotiations are happening, but I think it's just incumbent upon the provincial government to cover the cost of service. I have some empathy for the optometrists who have been delivering that service at a loss for many years now, and the province just needs to make the funding commitment that we cover the cost of delivery. I mean, most of the optometrists I've talked to You're like, we don't want to make money on these. We just want to cover our costs. We don't continue to lose money. And unfortunately, young people and seniors were the big losers. And so, making sure that the funding's in place to be able to cover full cost, to access all the available healthcare services that should be provided. And Andy, I want to just touch on mental health for a second, because I don't think we fully appreciate that mental health is health, and there's still a lot of stigma around mental health, and I think especially for older demographics. And I think one of the important reasons we've made such a strong commitment to make mental health services part of OHIP is not only to ensure that people can access affordable, comprehensive mental health care, but to also start breaking down the stigma around mental health. Nobody would be, hesitant to go to the emergency room if they broke their arm or, fell and, maybe broke their hip. But so many people are reluctant to seek mental health care. And then oftentimes, unfortunately, when they do, there's either huge wait times to access that care, or they simply can't afford it. And so we've made a very strong commitment. I'm, proud to say we're the first party that put forward a standalone mental health strategy in Ontario's history. And we want to make sure that those that comprehensive mental health care is available to everyone and is affordable through OHIP.
That's terrific. We haven't heard a lot of discussion about older adult mental health, particularly in the media. It's often focused on youth, but that
Yes.
stoic attitude of older Ontarians is, I think, often hiding some underlying issues. The last thing we talked about, and you mentioned already, was access to fitness for older adults.
Yes.
CARP is calling for a refundable tax credit to the tune of $100 a month, $1,200 a year. That would help older adults get over the hump of worrying about outliving their money and thinking that spending money on physical fitness and prevention is something frivolous, but encouraging them through that tax credit to really continue to engage in their own physical fitness. And we know that the knock-on effects and the positive health outcomes for people who stay active would more than offset the costs in the healthcare system. Would the Ontario Green Party support a fitness tax credit?
Anthony, I think it's a great idea. I'll be honest with you, and I think, and I'm going to say this in the context of the Ontario Leaders debate that we just had recently, where I think a lot of people said I performed well and the Ontario Greens performed well, but there was some people saying, oh, it's easy for them to do that because they're not likely going to go from one seat to forming government, so they can sort of promise anything. And I'll be honest with you, this particular policy proposal did not make it into our platform. So it's always important for me to be straightforward and very honest with people, because I don't want people to be able to say, I'll just say anything. But I think it's a fantastic idea. I heard you talking about this on a news station on the radio just the other day, and you make a very compelling case for this particular policy proposal. We do in our platform support investing in seniors community centers that would include and does include recreational programming, and also making sure that we build out trail networks and access to nature and parks that are fully accessible for anyone. But obviously we want to make sure that seniors can access those amenities in our communities and safely. Unfortunately, one of the biggest concerns I have right now, especially when it's seniors being more active, especially in their mobility in their communities, is just the increasing number of pedestrian fatalities that we're seeing on our streets and on our roads, and just making sure that we build infrastructure in our communities, especially related to transportation, that is people-centered and ensures that we have safe streets for all users, because no senior should be afraid to be able to walk down the street, whether it's for physical activity and exercise, or to go visit friends, or to walk to the local grocery store or convenience store. And we need to make sure that our infrastructure is designed in a way so those active forms of transportation are safe for everyone, but especially for seniors.
Well, Mike, I think I've taken just about all the time that you've promised me, and I do appreciate that. Just perhaps a final word from the Ontario Green Party, where we can find out more and why Ontario's older voters should consider voting for the Green Party.
Yeah, well, I'd really encourage all of you to visit our website, gpo.ca. By all means, don't hesitate to email us, phone us, however you want to connect and engage with us. And I would just say that we have a vision of how we can reimagine elder care in this province. And I believe our society owes it to seniors to honor elders and the contributions you have made and continue to make and will continue to make in our communities, in our province, and our society. Our platform reflects that, but it also reflects, I know, a deep care that so many elders have for their children, their grandchildren, maybe in some cases, great-grandchildren's future. And our platform is designed to ensure that Ontario is climate ready, because we know the climate emergency is bearing down on us. We know we can reduce climate pollution in ways that can save people money and create new career and better job opportunities. But I also think we owe it to the next generation to protect and defend this place we love called Ontario.
Mike Schreiner, leader of the Ontario Green Party, thank you very much for joining CARP and talking about the CARP 5 today. We appreciate your time.
Thank you, Anthony.
Thank you.